Hey guys, this is Dr. Samir Islam. I want to thank you for joining me. This month we're going through a series of celiac, and I want to talk to you about this time how I treat celiac disease and the approach that we need to take for patients who have celiac. So just as a recap from the last couple of weeks, celiac disease is an autoimmune disease that's a reaction against gluten products. There are certain products or certain molecules within wheat that can make patients who have celiac more prone to develop GI issues and other manifestations of celiac disease as well. And the main problem with celiac is that you actually lose the villi of the small intestine. So you have these villi that are there and they get sheared off, almost like blades of grass getting cut whenever you mow your lawn. And whenever the villi get sheared off, you have the inability to absorb food, vitamins, and nutrients. So a lot of patients who have celiac have deficiencies in vitamins, nutrients, they lose weight, have diarrhea, and have a wide array of symptoms for patients who have celiac. And these symptoms, like I mentioned before, can vary. Some people have diarrhea, just a lot of loose stools. They can't keep anything down. Food goes straight through them. They can also have constipation. They have difficulty moving their bowels, or they have to strain a lot to help them use the restroom. They can present with just bloating alone. They have a feeling like their belly is distended, or they're feeling pregnant all the time, and they have this bloating sensation that's there. It can present with nausea, vomiting, and also even stomach pain as well. Now, to summarize once again, there are a couple ways we can diagnose celiac disease. One is blood testing, in which you can test a blood test, called tissue transglutaminase. You can do genetic testing as well. And we can do endoscopic biopsies to confirm the diagnosis of celiac. And with that, we can actually take samples of the small intestine through a biopsy to see the range of celiac that you may have, determine the degree of problems that you have from celiac. So when somebody has celiac disease, how do I treat them, or what do I do to help them with their disease? The first thing we have to do is that we have to avoid gluten. Gluten is the trigger for why patients have celiac, and they develop this problem because the gluten actually acts as a autoimmune reaction against the small intestine. So it's that gluten molecule in wheat, rye, or barley that causes the small intestine villi to get sheared off. And so when you have the gluten going into the small intestine, the normal villi that are there go away. They're gone, and so you lose those villi. And when you lose those villi, you're not able to absorb normal nutrients or food or also vitamins as well. So what exactly is gluten? I have a lot of people tell me that they wonder what gluten is and what exactly is in gluten. So gluten is the general name for proteins that are found mainly in wheat, rye, barley, and a couple of other products as well. And what gluten does is it helps food to maintain its shape, acts as a glue that kind of holds the food together to keep it in the way that the food is whenever it presents to us. Now, gluten is in three main products that you may eat. They include things like wheat, rye, and barley. And in some oats, it may have gluten as well. This is why you have a lot of patients who eat carbohydrates or eat breads. They feel bad. They feel bloated. They feel like they have a brain fog, just don't feel well, have diarrhea. And it's because of that gluten molecule that's within the wheat, rye, or barley. That molecule is actually the component that causes the small intestine to lose those villi with the inability to absorb nutrients, causing those symptoms like I mentioned before, ranging from GI to non-GI manifestations. And this is why a lot of patients who have celiac have symptoms from eating bread, for example. Now, the important thing about celiac is that gluten must be avoided, and it must be avoided in all sorts of things, not just in food, but also in restaurants that cook, also restaurants as well. The problem with a lot of people who have celiac is that they eat in restaurants, they ask for a gluten-free meal, but that meal may be made right next to a meal that has a whole bunch of gluten in it. So you can get a lot of cross-contamination. So a lot of my celiac patients feel really, really bad even if they have a gluten-free meal if they go out. And the main reason is because there's cross-contamination that occurs from cooking a gluten-rich meal in the same area where you have a gluten-free meal. But gluten's in a lot of other different things as well. It's in makeup, lotions, and medications. And so you have to be very, very careful if you have celiac to avoid gluten not only in food, but in pretty much anything that's out there. Now this is different from gluten sensitivity, which I'll talk about next week, because the strictness of gluten does not have to be as prominent as it does in somebody who has celiac. Now, a lot of patients who have celiac as well, they also have lactose intolerance. And what that basically means is that because you lose those villi within the small intestine, those are also the location of where you can digest milk products like cheese, ice cream, and milk, obviously. And so a lot of patients, because they have celiac, they lose those villi. When they lose those villi, they also complain of lactose intolerance. So the main treatment and the only real treatment that we have right now for celiac is avoiding gluten, not only in foods, but in everything that's out there. Now, reassuringly, there are drugs that are coming out on the market going through FDA trials right now, which may help out with our patients who have a difficult time with the diet or may have problems maintaining such a strict gluten-free diet. And those medications will be coming out soon. But until then, the only option that we have is to be on a gluten-free diet. So coming up in next week's lecture, I'm going to talk about what the difference is between gluten intolerance and actually celiac. And there's a huge difference between the two. Though the symptoms may be similar between gluten intolerance and celiac, I'm going to explain to you exactly what the differences are and how we as clinicians can help differentiate between two, because you actually may have some problems with gluten, but you actually may not have the actual celiac disease.